Good morning, everyone, and welcome to today's Pediatric Grand Rounds. I'm Melissa Ruiz. I'm the Pediatric Residency Program Director, and it is my pleasure to introduce Dr. Brian Lonquich, one of our valued continuity clinic preceptors whose career reflects a deep commitment to caring for underserved and marginalized populations. Dr. Lonquich completed his undergrad studies at UC Riverside. He minored in Spanish, followed by his MD from UCR-UCLA Thomas Hayter Biomedical Program. He trained in internal medicine and pediatrics at UCLA, where he also served as chief resident, and then completed fellowship in pediatric emergency medicine at Texas Children's Hospital, Baylor College of Medicine. Dr. Lonquich is triple board certified in internal medicine, pediatrics, and pediatric emergency medicine, and has held faculty positions at Chalk, Loma Linda, UCLA Health, and now provides much needed primary care to adults and children at the SB County Franklin Health Center. Beyond the hospital walls, Dr. Lonquich has worked extensively in global health and immigrant health advocacy, from public health programs in Peru and Belize to policy work focused on unaccompanied minors at the U.S.-Mexico border. His academic work includes publications on state health insurance, access for foreign-born children, transition of care models, and clinical decision-making in pediatric emergency care. Today, he will be presenting Medicine at the Margins, Clinical Care for Migrants and Unaccompanied Children. Please join me in welcoming Dr. Lonquich.
Hi, everybody. Good morning. I see a lot of familiar faces in the crowd, and it means a lot to me. Thanks for coming. So I'm Brian Lonquich. That was a wonderful CV. Thank you for that. For the residents in the audience, I love my job now, and I'm here to persuade you that you should come work for county when we get past our hiring freeze. And I want to share with you stories from the front lines. I would like to make it abundantly clear that I am here at the invitation of Dr. Ruiz. I'm going to be sensitive to the contentious nature of this topic. I'm going to try to stay clear of politics. And we're going to get in the muck when it comes into policy and the implications for that when it comes to your care. I am here as a private concerned citizen that has fallen in love with Santa Barbara over the last 2 years and kind of want to stay forever. I am not here on behalf of the county. I'm going to tell you a little bit more about me while we get going here. So I was a global health doc. I worked for Partners in Health in Lima, Peru. I was really into TB, HIV care. I thought I wanted to be Paul Farmer. I thought I was going to be swashbuckling through Africa the rest of my life. And life had other plans for me. I found that I could have that same commitment to the people I want to care for and not have to leave the country. Thank you. And honor my responsibilities as a husband and father, which was important to me at the time. It still is. So I want you guys to settle in because Dr. Ruiz gave a wonderful talk, but this is going to have a very different tone. You're going to hear the anger in my voice, and that's not an emotion we're used to on the squishy side of peds. So I'm going to let you settle into it because it's not going anywhere. I think my goal today is to light that fire that might be going dim, the one that makes us check out of self-preservation. And maybe you're like me. Maybe you have a moral interest in this. Maybe you feel a need to stay attuned to what's happening in your community, but you can't bear it sometimes, right? I'm hoping to give you a scaffolding. I certainly don't have it figured out, but I'm hoping to give you a scaffolding that you can use to stay in the fight. There is evil happening right now, and I will not be a part of that machine. That's what we're talking about today. I am here to persuade you that the emergency is here. The canary stopped singing long ago. The emergency is here. This is CCOT. The New York Times did a wonderful photojournal on the conditions these almost exclusively men were staying in. Never in my life, and certainly not even 6 months ago, did I think we would snatch people off the street with people in flak jackets and balaclavas, unidentified Suburbans with Sonoran license plates, taking people off the street, not allowing them access to even a lawyer, extraditing them to another country, and maybe even a third country in which they don't speak the language. We are keeping them in a gulag. We are building concentration camps. None of those are political statements. They are facts. The emergency is here. I love California. Texas taught me that. We have a ton of immigrants. I bet you most people didn't know that we see more immigrants from Asia than Latin America over the last few years. We have double the national average. Immigrants come to the US, but they do not go to US states equally, and that's something we'll talk about. Especially in California, half of our kids have an immigrant parent. You better believe they're following this ICE stuff because the implications are real to them. These people are uncounted. We don't have a good sense of how many are documented versus undocumented. But it's more than you think that are on the right path to legal citizenship. And we have made it more difficult, more onerous every step of the way for them. And then we flipped the script and made them illegal. We'll talk about that too. And it shouldn't come as a surprise that Santa Barbara, especially northern Santa Barbara, has a huge migrant community. Think about how many farm workers you see on the drive-in. This gets back to my studies as a fellow. So in my last year of UCLA, I signed up for an elective called Community for Children. The residents should look her up. This woman's Marcia Griffin. She leads the AAP. She is my hero. We will talk about her. She taught me about the Flores Agreement, which if you're going to know one thing about migrant policy, you should explore that or have ChatGPT teach it to you. What it gets into, and a lot of this is being rewritten as we speak, it's an agreement that describes the detention, particularly of children, and the custody and replacement of these individuals or reunification. That's what goes over all of this, because as you can imagine, in the 90s, when you put kids back in the back of the van with the worst of the worst, bad things happen to them. Or when we had the people that were in charge of their detention, in charge of their care, the incentives were misaligned and bad things happened. So when all of this was restructured, the old word for this was INS. After 9/11, the Department of Homeland Security was created, and all of this was restructured. But it's important you know that the Office of Refugee Resettlement has nothing to do with ICE, right? It's a completely separate department. In terms of definitions, migrant isn't really a legal definition. It means somebody that moves. There you go. What's striking to me is how few people are migrants. The vast majority of humanity die 50 miles from where they were born, right? 1 in 30 people are a migrant. It takes an intrepid soul. It takes bravery. It takes, what really strikes me when we're having conversations about migrant issues is we don't talk about the consequences of inaction. I want to strangle these people that don't understand that the only thing waiting for these people in Venezuela is certain death. And what would you be willing to do for your family? Right? That's what we're talking about. An immigrant becomes an emigrant, becomes an immigrant, if you catch my drift. I do not like the term alien. I do not think it is possible to be a human and illegal. I will not use those terms. You are seeing them reintroduced on purpose. Withholding of a removal is a legal term that you should know, and that's how you stay in the United States while you are here undocumented, while potentially in deportation proceedings. An asylum seeker is not a refugee. The distinction is important. One of the biggest things we're doing right now is we are not allowing people to seek asylum. This is against the Geneva Convention. We are turning people away that are fleeing drug violence, that are fleeing domestic violence, that have credible threats from protected. There are only certain things that are protected. Even these crystal clear cases are being deterred. We are not following the rules anymore, and we're not even pretending to. This struck fear into my heart when I saw this. When, we knew the second term would be different. This set the stage. I would encourage you all to read about Project 2025. We played the cat and mouse game when he was being elected. It's clear that this is the agenda, and they're 2/3 done with their mission. It's incredible how much they've achieved in 5 months. This is one of the things, and it basically brings back the law that enacted internment camps during World War II for Japanese Americans. Right? These are the laws we're coming back to. Right? Are we really going to look back in 100 years and wish we tripled down on internment? It's unacceptable, and there's more that you can do about it than you think. The other thing that's changed is it went from a civil thing to a criminal thing. During the Biden term, we were very lax. COVID, made that challenging. There were certain titles that changed the way these immigrants were processed and deported that we're not going to get into because it's moot now. But we made these people illegal. Even people that were here as protected with a credible threat from where we were going to deport them. We made hundreds of thousands of people illegal with the stroke of a pen. The chaos is on purpose. So we are the only developed country I know that actively makes money off people seeking asylum. The private prison corporation has skyrocketed if you look at stocks over the past 2 years. When we're talking about alligator Alcatraz, right, we're talking about $400 million that's gotten taken out of FEMA, right? $600 million to build concentration camps on American bases. Cameras aren't allowed in, senators aren't allowed in. God knows what happens there. The other thing that's specific to migrants that's different from American citizens is they are not protected by the US Constitution. That's what a lot of people get wrong. There are 4-year-olds that sit by themselves for immigration detention hearings because they do not get counsel. There is no other area of American law in which you are illegal till presumed innocent, and we will keep you even if you are not a credible risk to anyone, because we make $200 a day off you. This was my fellows project. So as a peds emergency medicine, every fellowship you have to do a fellows project. I wanted something with the data already to go. I wasn't going to sign people up for a trial. So I looked at census data. And one of the questions that's asked in the US Census is, where do you go to seek care? When's the last time you were hospitalized? Those kinds of questions. So I compared those with an experiment that's already running in the United States. These dark blue that you see here, these are states that allow children to qualify for Medi-Cal or the Medicaid equivalent, regardless of immigration status. The ones in teal are somewhere in between, and the ones in light are restrictive, meaning there's a 5-year waiting period and you pretty much have to have your green card to be a citizen before the benefits turn on. I'm really happy to share, this was 5 years ago, I'm really happy to share that this is what it looks like now. There's a few more states. This is what it looks like for adults. And I think this is a pretty good idea of where migrants move. The only 2 states that I see are really missing are Texas and Florida, right? But guys, we are in trouble. If Medicaid access is revoked for people of documentation status, or if we have to be the ones that start checking papers at the front, we're as good as dead. That is over half the patients I see. Our clinic will not stay afloat. They talk a lot about rural hospitals, right? But that's not what they carved enough provisions out in the big beautiful bill. I think they might survive, and it's everybody's interest that they do. What we don't talk about is a place like CHLA, right, where 85% of their patients are Medi-Cal, hyper-specialized, right? If they don't get reimbursed for these months-long admissions, they're dead in the water. Nobody has this figured out right now. I promise no politics, and I mean it. What I don't think maybe the younger folks in the audience, especially those that grew up in Southern California like me, have a sense of is what it's like across the country, right? Texas was revelatory for me, right? I was used to, talking crap with my co's while we were pre-rounding in the morning about what was going on in the news because it seemed crazy. It was a different experience to realize people were nodding along to the idea that kids should be in cages, people I work with. That was hard for me. I love being in my blue bubble out here. But the truth is, that's not how we win hearts and minds. I don't need to persuade you. I'm preaching to the choir. What I want to do is arm you to, maybe give your relatives something to think about at Thanksgiving. All right, so about half of people think that you should be deported, but only a third of people think that it doesn't matter the circumstances for which you're deported, right? So if you've been here a while, if you have a spouse, if you have children, if you work, all of this changes opinion. it shouldn't come as any surprise that we are very polarized when we look at Republicans compared to Democrats, especially when it comes to increasing powers in terms of enforcement, right? But has anybody driven the border, like Texas, San Diego area, something like that? So it's changed in the last 10 years, right? I don't know, when I was in McAllen, it felt like Fallujah, right? There was a blimp. They had drones. There were thermal checkpoints, right? It felt like I was on the way to Chechnya sometimes. And it certainly didn't feel like the America I was used to, where I was being stopped and asked for my identification. When I look like this, you can imagine if I didn't, right? The other thing that's striking to me, especially when we look at the way Trump won in certain states, is how quickly we forget the migrant story, right? It's usually somewhere between the first and second generation when we look at when people return to national averages, right? But when we look at first generation Americans, their opinions of migration are very different than their children. And I think that's an interesting phenomenon that somebody should study. That's not me. The other thing is, I promised this graph on the right got worse in terms of people that are scared about ICE. We're seeing it now in our community. And what I learned in Texas is the fear is purposeful. The chilling effect is by design. They realize that it's a lot of hard work to knock on doors and find people. It's a lot easier to just park your truck in the grocery store so nobody shows up, right? That's the impact they want. They want people to disappear. They want to make it as miserable and onerous as possible till they give up. What they don't understand is there is no limit when the alternative is death. This pissed me off. I think every good piece of advocacy starts with getting pissed off about something. I hate this big, beautiful bill. I can't believe it got through. I am so mad at the Democrats for being feckless to stop this. And that's the end of my politics rant. Right? But we're talking about what we spend to send shit to space, what we spend to educate our entire youth. Twice the budget of every prison officer, every FBI agent, every ATF agent, everybody you could think of that rounds people up. We just doubled that, and it's only for immigration. The scale of this is staggering, right? We have tripled their army into the 13th largest military on earth. And there is no invading army. We're going to call that bullshit for what it is. We are not going to look at this through rose-colored glasses, right? The people that have been here for 2 decades, that have American kids, that pay their taxes, that contribute to our society, right? They are not Tren de Aragua. We are not confusing those, and we don't believe you when you say you do. This is and so I listened to the Bulwark, if anybody listens to that, and this one got me. We now spend 4 times more on immigration detention than we do for low-income housing. Our budgets betray our priorities. The other thing I think you guys should keep your eye on, that you'll see, I just saw this past weekend, just yesterday, over on Shoreline, people were protesting these 287 programs, right? So these are agreements that allow ICE to co-opt local authorities. We need to fight this tooth and nail. These are the states that are expanding it. I bet you're not shocked. These are the ones that are fighting it. These are the consequences when it comes specifically to migrant policy. This is a big one. So now people can't get, I think it's $1,000, $2,000 tax credit. If you don't have a social security number, you just got knocked off that. I looked into this 1% tax because it feels just like a poor people tax. Think about how much money we send, right? This is what migrants do. They come here, they make money, they send it to their family, they bring them here, right? That's the migrant success story. We just put a 1% tax on that, but it's in the hundreds of millions of dollars, and we're talking about hundreds of billions of dollars. So it's a drop in the bucket. This is a big one that was unacceptable to me. People that were here, people that went through all the channels, and you better believe, if you're in a Kenyan refugee camp and you make it here, right? I can't imagine your story. And we just stripped you of everything. There goes your SNAP. There goes your health care. Good luck. The other thing is these changes are already enacting. So the big one is CHIP. That's going to happen in October. This is another one that's in the news this week in terms of extreme vetting, and I'm conflicted about this one. I worked human trafficking in Houston. The horror stories of migrants, especially children that would come here, was horrifying. The story I think of is I was in the back of a church in McAllen, Texas. I was doing an inventory for a woman that was recently coming to the United States and migrating to family. And when I was asking about her medications, she said her mom put her on birth control. So I asked her about heavy periods or those kinds of things. And she looked at me like I had a third head. And she told me, my mom knew I was going to get raped when I got on the train. I think about that woman once a week. Right? For the parents out there, imagine the humility in that decision to go to the pharmacy to buy that med and to buy your kid a train ticket, because whatever was waiting for her was worse. These are the stories that will haunt you, and you have to stay in the fight, so you can't feel them. So we'll talk about the difference between compassion and empathy, and I encourage you to read a guy called Paul Bloom that talks about this. Right? You need to bear witness, but you can't feel it all. That's the tightrope I'm walking, and I certainly don't have it figured out. So, this extreme vetting, a lot of these kids were taken advantage of. They would be put with a maybe uncle, third distant cousin, whatever, and they would end up at a chicken abattoir, gutting animals at 4 a.m, working 14-hour shifts on their feet. One of the things that we're going to talk about is there's a recent raid in a cannabis farm, and a couple children were found there. Right? So we need to protect these kids because they are in danger. But some of this is bullshit too. Right? So some of this, they'll go to the families, they will make it as onerous as possible, and they will make it as scary as possible for you to put your name on that list. The consequences of that is that kid stays or that kid goes. So when I toured these facilities when I was in Texas, the Office of Refugee and Resettlement Facilities, it's somewhere between summer camp meets light detention facility. Razor wire, cots, and maybe some Barbies. It is no place for a child. These kids are there for months. The other thing that it changed is it made it even... how many Kenyan refugees do you think have $5,000 laying around? Right? That's the point. That's the point of all this. It's just come up with bullshit rules, give them more hoops, make it as hard as possible, knowing they will fail. Guys, guess what? The only way we save money by taking people off Medicaid is by denying services they need. These healthy, these 25-year-olds that are sitting on their parents' couch, not working and just eating up all these benefits, they don't go to the doctor and they don't spend money. The only way we save money is by telling people that need it, no. The people making these laws know that, and they're pulling the wool over everybody's eyes. It's our job to shed light on that. The other thing is now if you're caught and you don't go through legal channels, the CBP app that doesn't work, the detention proceedings that are now 6 years long, we're going to give you a fine you can't pay so we can send you to the gulag. This bothered me a lot. We have quotas. We're trying to deport 1 million people. So I was trying to do this in terms of school buses, and I got sad. We're talking 747s full of people. This is why when you're seeing, so this is like a purposeful tactic where you'll see them raid the car wash. You'll see them throw tear gas at the farm workers in Ventura, Oxnard, right? You'll see them arrest a chiropractor while she's picking her kid up at a preschool. Or a graduate student needs 6, plain officers to pull her from the street in a van, right? And then we disappear you. Your lawyers can't get a hold of you. Your family doesn't know where you are. We send you to Louisiana where the courts are more favorable, and we play the monkey game till we can maybe send you to South Sudan, right? And we are spending God knows how much money solely to screw you so you can send a message to the others. Our arrests are going up. The other thing they do is they just find an entry point. All they need is in, and they will find everybody else and look for reasonable grounds to detain them. Right? So they find one person with a warrant in an apartment complex, and all of a sudden 30 people are in the back of a van. That's how they do it. The other things that I think you should care about, this one is what's going to guide the rest of our discussion because I want to hear strategies for how you're adopting to this. Hospitals are not safe, clinics are not safe, private patient areas are the only protected area. You can't get there without a warrant. What's considered private versus public is something that's up to every institution, and you need to know where the line is and where these ICE officers aren't allowed to go. This should be part of every in-service for every ward, the ED, right? Where this is going to happen, we need to have a plan because it is coming. The emergency is here. The other thing that's changed is we don't even have judges anymore. So now you have an ICE officer who, as of this week, could be 17 years old. They got rid of the age cap. They will be deciding the fate of women escaping domestic violence. These are the cases I'd like you to keep your eye on. I hate policy stuff. I know just enough lawyer stuff to get me into trouble, but I'm going to show you a podcast where you can just check out and just get fed this. You should know about the Posse Comitatus Act. That's what allowed the use of the Marines. It's still being debated, but you better believe it was a test case. All right, there wasn't any violence they were squashing. They were there to prove a point. And it's going to come to Chicago and Florida and Massachusetts and all the blue states where they need to impose power. And that's where there's going to be conflict because it is inevitable. If you have masked individuals snatch people from cars in a place like Texas, somebody will get shot. The other thing, that's the just thinnest of veneers in terms of their way they're allowed to do this is the Insurrection Act, and they're calling migrants an invading army. Nobody is stopping. We're getting to the point now where they're lying to our face because they know they won't be called on it, because it's the truth. Other cases you should keep an eye on and support the ACLU, habeas. So habeas is like where you have to go to present yourself so that we could try to fix things or move things along with your progress. So a lot of this had to do with the Abrego Garcia case, right? I think it was very telling that this man was extradited back to the United States after we were told he couldn't, and then asked the judge to put him in jail so ICE couldn't take him again. That's where we're at. The other thing that's happening is the third countries. So the places you're going to see that are El Salvador with CCOT, South Sudan, places like Djibouti, places where we have black sites and can make you disappear and can send you to a place where you don't even speak the language. That's pretty crazy to me. Remember, they're not protected by the US Constitution. We can do whatever we want. The only ones holding us accountable are ourselves. This is another one to keep your eye on in terms of birthright citizenship. Right now it's blocked. I don't know what's going to happen. I have a bad feeling when it comes to the Supreme Court and what they've said yes to lately. But the implications of this would be enormous. Right, so I don't know where this goes. If both your parents aren't American, you just lost your Medicaid? I don't know, but it's scary and it's happening. We deal less with refugees and more with migrants, so I'm not going to talk tons about TPS, but in places like LA, I was just as likely to see somebody from Niger or Chad as I was from Haiti or Cuba. There are little enclaves throughout areas, especially in very urban areas, especially at a place like Houston. So all of these countries that you see here, they were previously protected because bad things are happening in these places and we wanted to provide humanitarian aid because we are the good guys and that's what we do. And we just revoked it overnight. They're now illegal and we're coming for them. Game's on. I love this woman. I want everybody to give it up for Judge Thompson because read this paragraph. This is what was in her opinion when she blocked this. The freedom to live fearlessly, the opportunity of liberty, and the American dream. That is all plaintiffs seek. Instead, they are told to atone for their race, leave because of their names, and purify their blood. The court disagrees. Oh, come on, that's a mic drop. Good job, Judge Thompson. This is what I really want to get at. This is what's happening right now. So in Canada's fields, they look for ways of entry. They look for grounds. So it's illegal federally or it's legal here and we don't care because we're the feds, so we're coming, right? And then we march these kids and we take pictures of them like they're trouts that we're proud of, right? That this is a drug bust with kilos of cocaine. Look how proud they are. This sickens me, right? I don't want these kids working in cannabis fields. I sure don't want them there either. And I don't know what to do about that. Right? But you'll see terms like this. This is in the newspaper. This is from the CBP website, right? This is from ice.gov. They arrested 361 illegal aliens. You see this term coming back? It's dehumanizing. It describes them as the other, and it allows them to do evil. Call it out every time you see it. So, bunch of town hall meetings. Santa Barbara showed up. I'm really proud of my community. One of the things that I think we really need to get at is not allowing ICE agreements. In terms of the things within our collective control, because so much is outside of our control, we can do this. We need to pressure our police chief, we need to pressure our mayor, and say, under no circumstances will we tolerate you partnering with ICE. Not in my exam room, not in my hospital. You'd be disappointed in some of the responses from other institutions. NYU threw their staff to the wolves. They basically said, if ICE comes, you give them what they want. Other places, I'm sure you saw this video where a nurse in a stairwell gets like choked by Darth Vader over here. That was pretty terrifying. We're gonna talk about what to do. Don't do this. The other thing that I wanna just plant the seed for is the way you access the EHR when it comes to migrants, because we are now looking at everything. So Bobby Kennedy a couple months ago approved this, and it's already happened. They have the entire nation's Medicaid database. They have every claim, every diagnosis code, every admission. You can do anything you want with it with AI now, right? Imagine with that metadata. How many times have you moved your address in the past year, right? Has anybody ever checked you for schisto? There are a million permutations in which you can clearly figure out who's a migrant, even if nobody asks, right? And we just paid Palantir $30 million, $30 million to build a surveillance platform, and this is deeply chilling. So, you guys mad yet? Let's do something about it. I can't fix it all. One of the things I've leaned on lately is stoicism in terms of controlling the things within my control. This is what is within your control. As a clinician, I am going to be more sensitive to my hospital discharges, not coming to clinic, not being able to see specialists because they're scared, right? You saw that. That was a literal chief complaint from 2 weeks ago on my schedule, guys. They canceled their appointment and wanted to go tele because of ICE. I say yes every time. If the goon squad shows up, your job is to not hold the line, right? Hopefully you have a designated person. Their job is to take the warrant, scan it, send it to counsel, make sure it's legit, and allow them access to that one person. That is all they get, and you better believe they will come for more. That is where you hold the line. Maybe this is where you have a little bit of fun too, but this is where my pugnacious spirit and the medicine side of me takes over, right? I'm so sorry, sir. I would love to comply with your order, but I can't see your face. I'm not allowed to comply with orders from masked individuals. Can you please tell me your name? It would take me a long time to photocopy that warrant while they're standing outside. I would have to continue my clinical duties and make sure all the patients in the lobby were in exam rooms. But the truth is, you're not a lawyer. You're not going to smell their bullshit. They give you blank warrants. They give you things that look legit. None of you have seen a warrant. You're not going to know if and think about the way your heart rate goes up if you're pulled over for a speeding ticket. When the goon squad shows up, you're not going to have your wits about you, and that's okay. So have a game plan. Have something you can fall back on, because we will fall back on our training. Conozca sus derechos. Make sure your patients know them too. Keep your mouth shut. If they're not here for you, you don't have to help them. One of the things that I need Cottage's help with is if we go under, they are coming to the ER. The only thing holding us up is EMTALA, and that's what comes next. Right? So we're going to be in a difficult position, which we are now having to refuse necessary care. Or your admins are going to be in a hard position. Is how do you admit these kids when you're never going to get paid for that admission? Do it anyways. Let them figure it out. One of the things that I'm sensitive to is I used to tell people when I'm getting them plugged into resources, yeah, no hablamos con la migra, no tenemos nada que ver con la policía. I don't talk to the cops, I have nothing to do with them. I'm not sure that's true anymore. So I stopped saying that, and that hurts me. I've said it 3 times because it matters. No ICE agreements. If you're going to do one thing, get loud about this. You're a doctor. People listen to you, even about things that aren't medicine. Take advantage of that platform. And then we're going to talk about resources for your patients that are already in detention proceedings. The single best thing you can do as a doctor for any of these people is get them a lawyer. It quadruples their rate of staying in the United States. The other thing, if you just want to get a sense of how much fear is out in the community right now, sign up for one of these alert texts. You'll stop it after 3 days, I promise. I like knowing what's going around. And this is where you'll see their tactics, where they purposely leave their trucks in common areas. So people know that we're out, we're around, we're watching. That's the chilling effect. I want to be sensitive to my time. I have a little bit of clinical care, but Dr. Ruiz did it better. These are the clinical conditions that I think you should have in mind when you're seeing somebody from a refugee clinic. We see a lot of iron deficiency anemia for a lot of reasons. One of the things that you should consider, especially in somebody from Africa, is G6PD. One of the ways I would catch that is if you don't come up with iron, and I believe that you're taking it. Eosinophilia is an American problem when it comes to allergies. It's a parasite problem anywhere else in the world, and you should treat it as such. Thrombocytopenia is more common than you think. When I was in Malawi, these kids would get malaria 2 or 3 times a season, the way kids here get the flu. This is the toolkit. Dr. Ruiz mentioned it. You should look at it. This is what's specific to a migration history that's different than all the other doctor stuff that you do. We need to do trauma-informed care. We need to be sensitive to the plight of people that ended up in our lap in our clinic. And we need to learn about their risk exposures without re-traumatizing them. That is an art, and you should learn it from somebody. The other thing that I want to encourage you to do is I'm making an order set right now for our county. Dr. Garcia is helping me with it. We're trying to do the same thing every time in every migrant, so we don't miss anything. One of the things that I've changed in my clinical practice over the last few years is including strongyloides, especially for people from, that have cruised through Central America. This is where schisto is. Think Africa, think Southeast Asia. This is where strongyloides is, pretty much the tropics. This woman is my hero. This is Marsha Griffin. You should be like her. I want to be like her. But my point with this slide is to tell you that you don't have to go to Sacramento. You don't have to know about policy. You don't have to live and breathe this stuff. You could just show up to a clinic once a month. Right? Savvy Health works up in Lompoc. I go there when I can. Doctors Without Walls has seen tons of this stuff. You can help them. Adults aren't that scary. Just give them Bactrim. Right? But what I want to encourage, especially the younger folks in the audience, is advocacy. You haven't been exposed to a ton of advocacy. It's whatever you want it to be. Nobody puts you in a box but you. You can be a full-time clinician, a part-time researcher. You can do advocacy work on the side. It doesn't have to be everything. Anything is something, and we could all be doing more. So this is what we do about it. If I'm going to give money, and I do, I give to the Undocu Fund, where they help provide emergency relief. This is where I go for my information, the National Immigration Law Center. Physicians for Human Rights does occasional trainings in LA where you can learn how to do one of these exams. So some people, while they're under deportation proceedings and seeking asylum, by having a physical exam that corroborates their story, it also increases their chances of staying. You could talk about ligature marks over the back or those kinds of things that support their claims. You putting your name down there as a doctor increases their chances. Nothing compared to a lawyer. This is a society I'm a part of. They have an amazing conference. If you're looking for like where to spend your conference money, go here. You'll meet some really cool people that will change your life. This is Savvy Health. They don't do enough kids yet. I'm working on it. I would love to get a peds clinic for some of our farm workers. If I get something going, I will let your program directors know. This is the podcast I listen to if you're just looking for something on the treadmill or whatever. Liz Dye feels my fury, and I dig this chick. She is mean with it, and she comes correct. And it's funny, and it's real policy, and when it gets too lawyery, you tune out. But if you listen to this every so often, you would stay abreast of what's happening. I also turned it into a ChatGPT schedule where once a week I look at immigration news. So I can cruise in and out, and I don't have to feel it every day, and I don't have to feel it every minute. This is where you should go to learn what Project 2025 is up to, and you would be appalled at how successful they've already been. This is where we go to make the map the impact. This is a really cool site called American Immigration Council. And then this is a nice website too, where one of the big differences since Obama is how much we're doing with executive action, because Congress is completely useless. So this keeps track of these executive actions because it's a lot to keep track of because they're coming out daily. I purposely left time so I can hear your stories. I would love to hear any questions about what to do if ICE shows up here. Please, I encourage interaction from the audience.
Thank you so much, Brian, and thank you for bringing anything, because we should be. I think a couple of things on the warrant. I know that our administration at our clinic said, like, you can actually look for details such as making sure it actually has the address of the clinic. It shouldn't have the address of the person's home, and it should have the correct birthday and the correct spelling of the name. Everything should be very detailed and specific, and those are all the things that can hold things up. And I think that can be super helpful. When you mentioned schisto, how they can just pull stuff, you're not implying that we shouldn't be testing for schisto.
Absolutely not. No,
or
but
strong glue.
No, but let me give you a pragmatic example. So I used to link it to the diagnosis code, history, immigrant. Yeah. So I stopped doing that. Yeah. It's a wellness visit.
So, and you think it still just gets covered and it's not an issue? Mm-hmm. We have this stupid little alert that comes up that says medical necessity did not pass.
Haven't had it yet.
Yeah. I mean, I figure it'll be fine.
Mm-hmm. But that's where, we kind of have to play 4D chess and think like the adversary here. How would you look up how somebody is a migrant? Don't make it easy on them.
I will also put a plug in. You've mentioned Marcia Griffin multiple times. She's on the executive board of the Council on Immigrant Health for the AAP. So that is all the residents. You are members of the AAP, and you can pick different councils and sections and things you want to be a part of and be on the listserv and hear about things. And I think the Council on Immigrant Health is great.
Thank you so much for this very timely presentation. Among all the concerns you've raised, I think part of the dynamic that makes this extremely challenging for us in healthcare is just how quickly things are pivoting, because our systems don't pivot nearly as quickly as executive orders, and trying to survive in a climate and continue to serve our patients when it's changing so fast. I know with the lawsuit, California suing the federal government, there's been an attempt to slow the process a bit to give some time for us to pivot and figure this out. But, and not that I expect you to have a solution, because I don't think really any of us do, but any thoughts there on how we can adapt and maybe try to slow processes that give us time to adapt?
That's where we really need the trial courts to do their job, and a lot of them are stepping up to their credit. Not all hope is lost. I was thinking, so Dr. Hughes and I were talking earlier this week, and one of the things I hadn't really considered as much as I ought to are the public health implications of these kids not being able to come to clinic and get vaccinated. If you want to protest this outbreak, this is a good way to do it. That's what we need to use in our armamentarium as physicians to persuade people that this is in their interest, even if they don't care. If I can't pull at your heartstrings, I can still pull at your purse strings and make sure you know why it's worth it.
And in your research, have you seen any news on the BFC program? Because I think for me, that's one of the biggest concerns too, is even if they they aren't able to access us through the clinic, are they still able to get vaccines through their VFC, or if that is threatened as well?
I think what it ultimately comes down to is if wherever you're getting your medical care now becomes the entry point for checking documentation status, I think that's the beginning of the end.
Thanks a lot, Brian. I have two things. One is that for when kids come into the clinic now, I'm trying to give them copies of parts of their record and their, like their vaccine records, because I know that they may have to leave on a dime. May have to leave really quickly too. So just trying to empower the families and give them the information so that they have it. We usually say, "Oh no, don't worry, it's in the computer system."
That's a great idea.
But now I don't know what I can trust. The other part is, the map that you showed from the research that you did that shows that who can get insurance and in what states where they're not getting insurance. What do those states do to care for the families that are there? I mean, do they usually just end up in the ER? Is that sort of that?
Yeah, so the big metric I found is it doubles where you go for access to care is the ER versus your PCP. That doubles if you're uninsured. I mean, guys, it's easy. If we don't pay for the metformin, you show up in DK and we spend 30 times as much. We know that. They also know that, and that's what bothers me.
Good morning. Is there anything being done to collaborate with school nurses, like on a Santa Barbara-wide basis?
No, but I love it. How do we get a hold of them?
I used to be one, I know some.
Okay,
So we can connect after.
let's talk after. I think that's a wonderful idea.
I just kind of want to echo what you were saying and how it's affecting us. I work in the pediatric clinic outpatient, and I'd say just in my department, we probably hear 2 or 3 times a week that people aren't coming because they're afraid to leave their house. And then even some of those who show up, they're having food insecurity or aren't exercising because they don't want to leave the house any more times than they have to. Mm-hmm. So it is affecting a lot of our people.
For the practicing physicians in the audience, whose no-show rate's gone up over the last 2 months? Yeah, it's palpable. I was trying to do slice or dice reports, and I'm not that good at it, but it's up.
And I don't know if you're familiar with La Casa de la Raza.
Tell me about it.
They're a local foundation, and they're taking donations, food, house supplies, things like that, and then delivering them to people who are affected.
Cool. I'll look them up.
Thank you for mentioning Casa de la Raza. Actually, one of our prior hospitalists from Cottage, Dr. Morgan Leaf, is heading up a lot of those efforts. You can find her on social media. So they're doing great work there. And thank you, Megan, for your comment about the school nurses. I attended a talk on school-based health care. And there's lots of models across the country for this. Some are supported by the public health department. Some are supported by their local hospital. So just as these things shift, be aware that these are opportunities within our community. At the moment, we do not have school-based health care for children. I am concerned about bringing the public health department into that space for these very reasons that we're having this in clinics. So just throw that out there.
Well,
Actually, and I worked at as part of my community medicine fellowship, I worked at a school-based health center, and it was a partnership between Kaiser and Planned Parenthood. So there are lots of innovative ways to get school-based health centers, and I think this is a very innovative community with a lot of passion for doing good things for kids, and so I think that's a really interesting idea. I'm going to just read a couple comments from online. First of all, Dr. Dina Hubbard said, "Thank you for advocating, speaking so boldly, and focusing on the humans involved. Appreciate your inspiration this morning. Silence is not an option." And we are formally approved to do the Cottage Center on Advocacy in Pediatric Health, or Education rather. It's called the CAPE Center. And so we'll definitely be pulling you in to do some work with us in that space. My Dr. Bleifeld said that her impression is that Savi Health is now essentially closed due to no funding. What's your
Oh, that's
knowledge?
news to me. That's supposed to be newer. They were just looking for physicians like a month ago.
Okay.
So maybe they're smoldering and coming back.
Yeah, maybe just. Yeah.
They're certainly the right people to contact.
And then Dr. Sharma, who is a pediatrician at Santa Barbara Neighborhood Clinic, said, we've recently designated specific patient care safety areas at our FQHC beyond the waiting room. And yeah, I will speak to the administration at SBNC was excellent. They came around months ago to each specific clinic, pulled us all out of patient rooms, patients waited, and we talked about this. So the administration has been very supportive. And then Dr. Sharma also said, Bill Cassidy says it all the time, if we offer insurance, this encourages illegal immigration, which is, I think, rumors.
There's something pretty twisted. Like, we just had Fiesta. You know who didn't go? Hispanics, right? This feels like bizarro land sometimes. Guys, thanks for coming today. I got a lot out of this. Thank you for giving me this.
Thank you so much. Thank you for all that are online, and have a wonderful day.